You're watching Cetome TV. Knowledge is power.
Speaking of which, let us discuss what a liquid biopsy is.
Okay.
For those at home who might have heard about it and have some sense, okay, it's got something to do with blood, but how the heck does it work?
So tumor cells release their DNA into the blood. Dead tumor cells release their DNA into the blood when they get killed by treatment. Tumor cells, when they're metastasizing, travel through the blood. They also travel through lymphatic tissue too. Let's see, normal cells release DNA into the blood. And exosomes. One of the newest findings is tumors actually are found to spread through a process called exosomes, extracellular vesicles. And what they do is they package DNA in different molecules in these vesicles, and they release them into the blood when they're metastasizing.
Oh,
and
that's how cancer travels through the body.
We used to think that it would spread and grow in different areas, but now we know what happens is these exosomes in a lot of cases will travel through the blood, and they will go to different parts of the body, and they will actually convert normal cells and cells in the tumor microenvironment into cancerous cells. And so it's like a Trojan horse.
It's like the Borg.
Yes, it is like the Borg.
For you Star Trek fans out there, it's the Borg.
Or Trojan horse is what I mean.
Okay, Trojan horse.
Zombies.
All right, okay.
Zombie invasion.
All right. So how do liquid biopsies work?
So most liquid biopsies just take all of the DNA in the blood, and if they see that mutation that they're looking for, then they'll say, okay, here's the mutation. We've developed a liquid biopsy test, as you know, that isolates exosomes first. We find the exosome DNA because that is what is causing the metastasis. And we look for the patient's mutations in that exosome DNA. And so what we do is we measure it before the patient has a treatment, and then directly, 2-3 weeks into the treatment. And if the ratio of that exosomic mutation that is driving that person's cancer goes up or down, we're able to determine right away whether the treatment's working. And that's very important when you're dealing with a drug that's costing you $10,000, $20,000 a month. And the doctors typically want you to be on the drug for 3 months, and they want to measure your tumors, with PET CT or something. And then 3 months later, you find out the drug didn't work, and you've spent all this money. You want to know right away. So this test is a revolutionary change.
So in addition to just saving certain patients money, because many patients don't have to pay out of pocket for medication, although I appreciate Alex is always very concerned about finding the least expensive option for people, which I do really appreciate.
Yes.
And most of the time, patients don't have to pay out of pocket for their care, even some innovative options. But the other benefit, as you just said, really is it's so fast.
It is.
You find out within just a couple of weeks whether that treatment is working, as opposed to anywhere from 3 to 6 months with standard testing.
And more importantly, this test is specific to each person. So we designed this test for that person.
Right. So it's personalized.
It's personalized.
It's based on their mutations and their bloodstream and what therapy you've designed for them.
Exactly.
Yeah. Okay. So, nutshell, liquid biopsies or blood-based tests. There's 2 different kinds, essentially. There's the one that looks at, it's kind of broader. It's called circulating tumor DNA.
Yeah.
And that's the one that you were talking about that kind of looks at whether it's a dead cell and a live cell or just kind of naturally occurring in your body.
And that's what Garden 360 is.
Okay.
They take all of the DNA out of the blood, and then they just see it. And so that's good for determining discovery. Exactly.
Yeah, they're telling you if it's there or not.
Exactly.
But they're not telling you what's happening.
Or if it's from a live or a dead cell.
Right. And now, for those at home, what's important about knowing whether that DNA that's happening is from a live or a dead cell?
Well, you want to know if the cancer is in a metastatic process or if it's responding to treatment or not.
Okay, so live would be metastatic. It's growing. It's in the bloodstream, trying to find places to land.
A place to go. Yes.
And if it's dead, then it's responded to treatment essentially.
Yes.
Okay, right. So with standard ctDNA testing, you can't differentiate between the two.
No.
In fact, didn't we not have a case early on, it could have been 8 years ago or so, where using standard ctDNA, a patient was removed off treatment that had been being beneficial, or what was that? Was that imaging that made that
Yes, I believe that was PET CT, yeah.
Okay, so that was a difference. Oh gosh, now we're into a whole nother discussion, but we won't go there just yet. Okay, so that was the imaging related, how with the CT and the PET CT differential between live and dead tissue.
Thank you for watching Ketome TV. Subscribe below and stay informed.